One of the challenges of internally displaced persons in Nigeria is access to healthcare service, which is the second important consideration after food, water, and shelter. For the people living in Guruku Interfaith Relocation Internally Displaced Persons Camp in Mararaba Aso, a suburb of Abuja, access to healthcare is a major challenge as the only source of medical presence is the relocation camp clinic built by the Swiss Embassy, Abuja, which hardly opens for lack of personnel to run the place. You can imagine their joy when a non-governmental organization, Zawram Islamic Global Foundation, in collaboration with the Yakubu Gowon Center and the Federal Ministry of Health, took an intervention program to the Guruku relocation camp on viral hepatitis, hypertension, and infection prevention and control to sensitize them on some of the basic ways to stay healthy and avoid infectious diseases. For Barrister Zainab Marwa Abubakar, the CEO of Zawram Foundation, helping the less privileged is like a calling for her, as that is the only way she feels she can help give back to the society.
I think it's my purpose in life. Yes, I'm a barrister, but I mean, we can all be humanitarians if we want to. We can mix it up if we wish. So I'm a barrister by profession, but definitely in my heart and my purpose in this world is to be a humanitarian. We get funding from organizations, from individuals. This Omo that you saw us sharing, for example, was donated from England. A lady said she wanted to send something for the inhabitants of this camp that they would use to clean themselves up. So she sent them. We do a lot of charity, a lot of food, clothes, and the rest. But this, as you know, is on hepatitis and hypertension. It's health-based. So this is our first action.
For Mr. David Wendu of the Yakubu Gowon Center and Dr. Omede Ogu of the Federal Ministry of Health, viral hepatitis, hypertension, and other communicable diseases are very common in places like internally displaced persons camp, with low awareness where emphasis is mostly on survival of the fittest.
Well, the prevalence rate in the entire country is 11% for B and 2.2% for C. But what normally happens in a place like this is the condition can up it a little bit, but not very outrageous.
But just like you have seen in the course of orientation of the camp now, out of over 100 adults and children, excluding children, I ask a specific question. How many of them have heard of viral hepatitis before now? You saw the response, nobody. So from this meeting now you could see that the awareness level is a major challenge. And if people within the community, the general population, don't know, how then can there be outcry for the control of this disease? So it's been one of the major, number one problem is awareness.
Dr. Omede also gave a little overview on the effort of the Federal Ministry of Health on viral hepatitis.
And generally implementing partners that have specific interest for the control of viral hepatitis. And this technical working group has so far been able to develop a national policy for the control of viral hepatitis. I could confidently say that Nigeria is one of the first globally that have done that. We have also developed a national costed strategic plan spanning over the period of 5 years, 2016 to 2020, which has placed an average cost to implement viral hepatitis in the country at $131 million conservatively. And then we have developed a national guideline for the prevention and control and treatment of viral hepatitis. So these are some of the things that the Federal Ministry of Health have done. And a lot of other NGOs have also contributed their effort, staggered all over the country to see what they could do. And then together we could speak with the same voice.
They also took time to advise Nigerians on what to do to avoid late diagnosis.
My advice for Nigerians is two. The first is that we should love our neighbor, our brothers. We should show love to everyone. We shouldn't think that we're better than anyone. I believe Hemingway said that there's nothing noble in being better than other people. What is noble is being better than you were yesterday. So I think that is the main thing that I want people to take away. And also, we shouldn't stigmatize those that are not where we think we are. So all these people in the IDPs, all the people that are not rich or clean as we feel that we are, we should spread our hands out and embrace them. We shouldn't have any stigma in our minds.
Nigerians generally should test and find out their status. When you test, there's national policies that once you test a person, vaccinate the person if he's negative, so that there will be no exposure to further infection or to infection at all. So if you go for a test and the test is a place recognized by Federal Ministry of Health, you are bound to get the minimum package, which is test and vaccinate. So I encourage Nigerians to go ahead, test, and if the person tests negative, he gets vaccinated. If he tests positive, go for further evaluation so you know how the management is going to be, whether it's a chronic issue or a clinical case or an acute case.
Know your viral hepatitis status. If you don't know, go for a test. Protect yourself and your family.
The visit, which featured talk and awareness section, gave room for the displaced persons to ask questions bothering them. The women were also given some relief materials to help cushion the effect of the hardship on them. In Abuja, I am Festus Ejiroge Nefife for